Hello everyone, hello everyone, and welcome to this audio podcast. This audio podcast is part of the Haemotoxy. This audio podcast is part of the Bostics and the Baraga. This audio podcast is part of the specials. This audio podcast as part of the Express and Caliber, and this audio podcast is part of a Storm Robotics production. And through this audio podcast, and sort of now to conclude to conclude in on this works by science student Hussain from an academic institution in the UK. The basis of this audio podcast will be in around the sort of conclusion wherein Hussain looks at the sort of suspect basis of M tuberculosis diagnosis as part of a patient case, and where a pulmonary lobectomy specimen had been obtained from a clinician, and then was and where the specimen had gone to the laboratory, to the histopathology in as part of the histopathology division of laboratory, and where M. Hussain sort of looks that informs of the sort of findings, some of the findings. So to conclude, the patient case in on this is where the diagnosis from the pulmonary lobectomy specimen presented sort of some important findings, such as where findings through the use of bacilli that was stained with a carbon fusion staining was carbon fusion. Carbon fusion staining allowed sort of visualization, allowed sort of visualization, and this the visualization was indicative of tuberculosis, and should be and what and sort of should be and was utilized. Utilized to help a clinician to begin particular pharmacotherapeutics, to inform the clinician to encourage or prescribe the patient case with particular pharmacotherapeutic treatment for and as part of the tuberculosis. The current recommendation was part of the recommendation for drug sensitive or pharmacotherapeutic sensitive tuberculosis. Where the science student M. Hussain had, when at the time when M. Hussain, the science student, had formed this overview. This overview is where the current pharmacotherapeutic recommendation for tuberculosis involved a combination of isoniside and rifampicin and pyranozide and ethambutol to be administered or prescribed for about 6 months. drug susceptibility testing or investigation, and nucleic acid amplification may be carried out after 3 months of antimicrobial or antibiotic pharmacotherapy if symptoms did not subside. These methods uh, are utilized to distinguish between drug sensitive and drug resistant, or pharmacotherapeutic sensitive or pharmacotherapeutic resistant tuberculosis, which requires a sort of a narrow treatment, regimen, including pharmacotherapeutics, the patient case in this in on this works. And whether tuberculosis isonate is also susceptible. So that draws this audio podcast to a close, and this audio podcast as part of the Haemotoxy, this audio podcast as part of Apostolics and Baraga and the specials, this audio podcast as part of the Express and Caliber, and this audio podcast as part of a Storm Apostolics production.